Hi, I'm Dr. Choong Fong, consultant ophthalmologist at the International Specialist Eye Center. In this video, I will be discussing a very common condition known as allergic conjunctivitis. What is allergic conjunctivitis? Allergic conjunctivitis is a reaction of the eye to things in the environment, such as dust, pollen, animal dander, and medications. It is not an infection and is therefore not contagious. Most allergic conjunctivitis is mild, but some can be very bothersome and in severe cases can even cause visual impairment. What causes allergic conjunctivitis? Seasonal allergic conjunctivitis occurs when a person comes into contact with something like pollen or mold that she is or he is sensitized to. Spring, summer, fall allergies tend to be due to what is blooming outside during those times. In warm tropical countries like Malaysia, allergies tend to be due to house dust mites and animal hair. Sometimes food allergy can also trigger an allergic reaction. What symptoms will my child have? Most frequently, there will be itching and watering. The conjunctiva, in other words, the thin membrane covering the white part of your eye and inside the eyelids, will be pink and bloodshot. The conjunctiva can swell so that it looks like a clear blister on the surface of the eye. Other symptoms often encountered include stinging and burning. The eyelid skin is very thin, so it can become very swollen. Many children rub their eyes constantly due to this persistent irritation. Unfortunately, this tends to make the swelling and itching worse. But even adults find it hard not to rub their eyes, so it's understandable. But do try to prevent children from rubbing as much as possible. Is allergic conjunctivitis the same as infective conjunctivitis? A simple answer is no. While the eye with allergies is usually bloodshot and pink, it is not contagious. Infective conjunctivitis indicates a contagious infection from viruses or bacteria. While other symptoms may be similar, usually pink eye from a virus will be more irritating with a greater amount of tearing and discharge. Discolored mucus and the eyelids being stuck together in the morning are common with bacterial infection. White strings of mucus which don't stick the eyelids together are common with allergic conjunctivitis. A question that I get asked often is, does my child need allergy eye testing to see what is causing the allergic reaction? Not usually is my answer, since treatments are generally the same no matter what allergen is causing the reaction. Also, the types of allergens are usually very common, like house dust mites, grass, weed, or tree pollen, which are often hard to avoid. However, in some severe form of sight-threatening allergic conjunctivitis, an allergic test may be helpful to determine the offending material. The following are treatments often used to treat moderate to severe allergic conjunctivitis. Cold compress is often effective in relieving the symptoms of allergic conjunctivitis. And sometimes this is used for children to bring relief so that they can carry on with their daily activity. Artificial tears or ocular lubricants are simple over-the-counter eye drops that can be used to give symptomatic relief and to protect the integrity of the ocular surface, improving symptoms and preventing corneal damage. Antihistamines eye drops, or oral antihistamines, reduce the release of histamines, a chemical that causes itching in allergic conjunctivitis, and this can bring symptomatic relief by reducing itchiness in the patient. Steroid eye drops are sometimes used. Sometimes a short course of steroid drops along with antihistamine type eye drops is required to quiet down the allergic reaction. Steroid use should always be done under supervision, since there are significant side effects or risk associated with its long-term use. One such risk is glaucoma, which can occur from prolonged steroid use. Another is early cataract formation. Both these conditions can result in impaired vision, and as such, the use of steroid drops should always be supervised by an eye specialist. Immune-modifying agents like cyclosporin A, tacrolimus are specialized treatment in more severe forms of allergic conjunctivitis. These medications are generally only available from specialist eye doctors. I hope you find this video helpful. Thank you very much for watching.